Our case counts continue to tick up and hospitalizations are also up slightly. So Dr. Bettigal will announce why we're implementing new mask mandates for businesses and events and a vaccine and mask requirement for city employees. The updated policies we're implementing are critical to slowing the spread of the Delta variant of COVID-19, which is more dangerous and transmissible than earlier forms of the virus. The science is clear. These measures will protect Philadelphians and save lives. We strongly urge everyone who has not yet received the vaccine to get it immediately. Please, just get the vaccine. This could all be avoided if we just did that. And if you're due for a second dose, please be sure to get it. It's the best and safest way we can get through this deadly and unpredictable pandemic. We flattened the curve before, and we must do everything in our power to do it again. So now I'll turn it over to Acting Health Commissioner Dr. Cheryl Bettigal.
Thank you, Mayor, and welcome everybody. Thank you for being here. So I continue to be concerned with the rise in cases and hospitalizations in Philadelphia. We have seen how quickly things can get out of hand with the Delta variant in other states. We're hearing from other cities and states that their hospitals are full. So full that there's a risk that someone with a heart attack or an injury may have to be taken to a hospital hundreds of miles away for care. We're not nearly to that level, but our average new cases per day have doubled 3 times in the last month. We're seeing nearly 200 new cases of COVID every day now. And for the first time since early June, more than 100 people are in the hospital in Philly with COVID. This is not the summer any of us imagined. We had hoped that our high vaccine rate, more than 77% of adults had at least 1 shot, and 63% of Philadelphia adults are now fully vaccinated. And our recommendation for folks to wear masks would slow this virus down. Unfortunately, that hasn't happened. As the mayor mentioned, today we're instituting a few new policies. I need to stress that these are just a next step. We will be watching the numbers closely. We may need to adjust safety measures if they continue to rise. First, we're instituting a mask mandate in Philadelphia starting tonight at midnight. That means that everyone in Philadelphia must wear a mask when going into any business or institution, with an exception for those that require vaccinations. Restaurants and bars will need to require masks for all staff and customers, except when people are seated and actively eating and drinking. If a business or institution is requiring that everyone, including staff, be fully vaccinated before entering, then no one in that place needs to wear a mask. So there is an exception for places with a vaccine mandate. Because of the high risk from COVID to seniors and those more vulnerable to high temperatures, we're requiring masks to be worn in the city's cooling centers. And that policy will start at noon today, while the citywide mandate will begin at midnight. We want people to feel safe going to our cooling centers. Additionally, unseated outdoor gatherings of more than 1,000 people are required to have everyone masked. In accordance with this policy, city buildings will require that everyone in public areas be masked. Again, that mask mandate starts tonight at midnight. The second thing that the mayor referred to is our new employee vaccine and mask requirements. On September 1st, all new employees hired by the city will be required to be fully vaccinated against COVID. Current employees will be required to either be fully vaccinated or to double mask whenever they're in an indoor space with others. By double masked, I mean that they need to wear a disposable paper mask or surgical mask underneath their cloth mask. By wearing both masks like this, research has shown that you'll be protected almost as well as with an N95 mask. So you understand what I'm talking about. I'm going to demonstrate how to safely double mask and why. So here is my paper surgical mask. I put this on, loops over the ears, and I pinch the nose. I've now pulled this under my chin, so I'm masked. But you can see that there's some little gaps here at the sides, right? So what the cloth mask does, I always have to check that it's right side up, is that it goes over the top here. It gives me those extra layers of protection, and your cloth mask should have 2 layers at least. And it makes this fit more tightly. It closes off those openings.